loss of limb, cancers, all of these things. Try to have a balanced, good diet with more fresh produce if possible. Third is smoking. I don't want to pontificate, but smoking is the most important social decision you can make. If you smoke correctly, it's 50% of people will die from their smoking. So really, let's not do that. I think one that's really big, which we don't recognize, especially as guys, is stress and depression. We know that it can cause damage to all our parts of the body. Again, we need to get that addressed. Don't think that just because you're under pressure that it's normal for you. Get yourself checked out. And then, of course, the fifth one, just no excesses of things such as alcohol and other drugs.
Okay. So those are the big five.
The big five, yeah.
All right. So what should men know, when it comes to the big five? What should we do in terms of lifestyle modification and
Okay. First of all, I just we remind guys that a lot of people think, oh no, you're going to get symptoms from almost all these conditions, be it from cancers to heart attacks, when we know that 50% of people who die from a heart attack or stroke are walking down the street feeling perfectly well. You need to be seen by somebody on a regular basis. It doesn't mean you just go there once a month or something. Even just like most women who are clever enough to go and actually just get checked for various conditions once every couple of years or once a year. Just do the same. It literally can be 5-10 minutes. And I know one of the things that guys get worried about after the 40s about prostate cancer and other issues. And we used to have to put a finger in the anus to feel the prostate. That's no longer part of guidelines.
I guess it was like just listening to it, it explained why a guy would not want to go,
That's true. That's true. But now it's no longer guidelines, guys. You can just go for a blood test. Take it easy. And I always say that women are so much more braver than guys. When you go for a pap smear, there's a cold speculum that goes in there, and there's scraping and everything, and we're worried about a finger. But anyways, the short answer, you don't need to get the finger. Don't need to get the finger unless there's some other issues, and so generally just get yourself checked out. So I think, but if you get yourself seen on a regular basis, make sure that you do do the big five, taking good care of your health. Your chances of living long and healthy are excellent. In fact, the life expectancy is supposed to go up by to about 82, I think, from the South African data in the future. But if you don't do that correctly, you're going to be ending up dying at a younger age and missing out on all the joys that you might have for the rest of your family.
And your wife will get married to someone else, probably your best friend.
That's it. And
all these health.
And the thing is, the sexual prowess is best for guys between the ages of 18 and 22. After that, we start to decline a bit, but if you're following the big five, you can still maintain. But females, they peak between 41 and 43. So if you're not taking good care of your health, your partner will not be getting enough satisfaction. So do take good general care of your health.
So if you're just tuning in, it is Star FM Wellness Wednesday. We have Professor Shingai Mutambiwa, and we're looking at men's health. He was just explaining to us the big five. He touched on prostate cancer, erectile dysfunction, just different things. So I'll allow you to take the flow and lead us as you should. Yeah, Professor.
Oh, sorry.
Yeah.
Yes. Oh, sorry. I thought you were going to a song. Never be.
Not yet. We'll go to a song.
Okay. Yeah.
Yeah.
No, I think most of the aspects of health are pretty much easy to understand. I don't think anyone. It's just that most people are not taking control of their lives, basically, be it from the amount of stress you're having or just the amount of physical activity you do. So I think, and almost everything is interrelated, whether it be your sexual function, whether it be prostate cancer, whether it be heart attacks. They're all interrelated, and really just taking good general control of your health is so important. And I think one of the things for guys particularly is that, for example, if we look at the statistics, up to about the age of 16, male and female children have similar outcomes for health. But after 16, that's when the women who are obviously cleverer than guys say, oh, okay, my parents have been taking me to see a physician once a year or so. I'm going to continue to do that. But the majority of guys will now say, oh, no, I'm my own boss. I'm not going to do anything. I'm not feeling unwell, so I'm not going to take care of my health. I'm not going to go get checked out. And that's one of the reasons why we die at a much younger age than females. So, again, it's about making sure that you take care of your health and make sure that you, and as I said earlier about stress, I think stress is one of the biggest issues. Stress, depression, under recognized by everybody in the world at the moment, and we really need to address it, because stress itself is like a chemical, like sugar diabetes, like high blood pressure, causing damage to the inside coating of your blood vessels, which then causes you to get heart attacks, strokes, loss of limb, inflammation, cancers, all because of this. So I think if it's a take-home message, no stress. Remember also, obesity is a huge issue now. We've got and worst part is that, because we know that, for example, in South Africa, 30% of people are obese or overweight. It's a dangerous condition. It can cause you to get heart attacks, strokes, diabetes, all those things. But also, 30% of our children are also now becoming obese or overweight, which is really worrying, because that's, I mean, when I started my medical career, to see a teenager with sugar diabetes was almost unheard of. We'd have to publish in a journal. Now it's relatively common, and it's all because we're not taking control of making not only our diet and exercise, but also even our social and economic factors, which are a big issue. But it's not the time for this discuss that. But I think we also have to look at our structures, the governmental structures and things, to look at a way of making sure that we improve the health of our nation, because it's also a cost and a burden to the country as well.
Mm-hmm. Got a question here saying, my urine is mixed with blood. What could it be?
Yeah, blood in the urine, we call that hematuria. And if you're looking at it and there's been no injury, there's been no trauma or anything, unfortunately, blood in the urine can be a big issue, because about 30% of people who have blood in the urine that you can see can have some type of cancer, be it a kidney cancer, bladder cancer, sometimes prostate cancer. As a proviso, though, just remember that when you ejaculate and sperm comes out, it's when you ejaculate and you see blood in the ejaculate, that's called hemospermia or hematospermia. It's far less likely to be caused by cancer. But either way, you need to get an investigation, and don't get too stressed. It's not too much of a big thing. Usually we just do some urine tests on you. We get a bit of a history. We might have to use a camera to look into the bladder to see what's going on. But it's most of the time, if we pick it up early, even if they're cancers of kidneys or bladder, they're usually quite easy to treat, provided we pick them up early. So please do go and get yourself seen by your urologist.
Thank you so much, Professor Shingai. We're going to take a musical break. We'll be right back looking at men's health. We're also live on Facebook. You can join the conversation. If you have any questions, feel free. Our WhatsApp platform is open, 772-1626. Sunny L Musician really makes spiritual house music, right? And each time he also collabors with Amy Fako. It's magical, featuring FKA Mesh Makwande. 29 minutes past 11. It is Star FM, sounding good all the time. Listen. I'm V Candy. It is a morning galaxy, your big morning cruise into the stars, into the galaxy. And joining us live in the studio is Professor Shingai Mutambirwa, looking at men's health, and also something to look forward to tonight at Royal Harare Golf Club from 6 p.m. There will be a talk on prostate cancer and men's sexual well-being for only $15. You can have your seat there and just get to learn and also interact, ask the vital questions, and get to know more about these things that are paramount to your health. So we're looking at prostate cancer, erectile dysfunction, premature ejaculation, longevity, and sexual health, and also how ourselves as women can also help our partners with their sexual health. So if you have any questions around that, feel free, feel open. Our Facebook as well, we are live there and it's also open. So I'm gonna take a question here, Doc, and then we continue from where we left off. And what's the effect of having sex whilst menstruating on men? Can you break down for us? There are some myths out there.
Yeah. First of all, just do a proviso before I answer the question. The money that's going to be paid tonight is not for any doctor per se. It's for training of urologists in Zimbabwe. So it's you're giving back to your community when you do this. So it's not a money grab. Don't be worried by that. Okay. Now, myth. Having sex when a woman is menstruating has essentially no problem at all. I think there's
No problem at all.
no problem. In fact, the only, I mean, if you've got other issues, of course, like you've had previous STIs and you're bleed, then that's a different issue. But menstruation is not a dangerous condition. It's actually just basically what's happening is that every month a woman produces an egg. If it doesn't get fertilized, the inside coating of the uterus sloughs off and goes away, and that's all it is. So it's just basically some tissue that's down there. No danger. Short answer: if you like having sex during when the woman is menstruating, or if by mistake in inverted commas you have sex, really nothing to worry about. But it's the proviso, of course, that depends on if you're with a steady partner and that sort of thing. Make sure if it's HIV or anything like that you're worried about, there are post-exposure prophylaxis, and there's also STI post-exposure prophylaxis. But it's not the bleeding that's causing the problem. It would be an STI.
Okay. Got a message here as well, Professor Shingai, saying my sex drive is too much to an extent that sometimes I feel ashamed for my partner. Is there a way to lower it?
Okay. There are many ways you could lower it, but I don't think you want to lower it. I think that most guys do want to live their feeling. I think what this boils down to often is the what guys do very poorly, which is communicate. I think if your partner is if you communicate with your partner and explain what your situation is, and you can have a discussion, you can also then make plans around what you're going to be doing, because the libido or the feeling of having sex is based a lot on the so-called man chemical in inverted commas, although testosterone is important both for men and for women's sexuality. In fact, female sexuality is mainly based on that, not on estrogens. But the point is, if there are some conditions where you can have an increase in the testosterone in youths, but after you get out of puberty, it's pretty much the level of testosterone doesn't really make that much of a difference to changing your sexuality unless it drops below a specific level. So I think if you feel like you're oversexing somebody, then you must have a word with your partner, and it might be that maybe the partner's complaining because it's getting sore, and maybe you could consider lubrication and that sort of thing. But I think it's a matter of communication. You have a discussion with your partner, and there are lots of good romance therapists and sexologists out there who can have that discussion if it's really a bother.
Okay. Hi, Vikendi. Hi, Professor. I was treated for an STI 2 years ago, but since then I've been having lower back pain. What could it be?
It could be anything. I'm sorry, but the point is that I think we must remember that essentially every symptom can be attributed to literally thousands, if not millions, of different things. And I think it depends on your age, it depends on whether you had an injury, it depends on what sort of STI it was, because remember, there are different types. There's discharges, there are ulcers, there's other things. But as a general rule, if you had an STI and it was treated 2 years ago, I would think it's very unlikely that that's the cause of your back pain. And there are some relatively nasty things that can happen from any symptoms that you're having. And for example, back pain in older men is often related to prostate cancer when it's spread, so has to be checked and that sort of thing. The only way to do that is to go and see your doctor. And by the way, the GPs are excellent guys for doing most of the tests. You don't need to be rushing off to urologists all the time. Rather start with your GP, have a discussion about once a year, and then have a discussion with them about your back pain. But there are reasons why an STI could cause you back pain, but the chances of that being the cause are pretty slim.
All right, I'll take another question before you continue from where we left off. Hi, Vikendi and Professor Mtambirwa. What are the effects of low testosterone, and can it be raised naturally? Oh
yeah, great question. Yeah, the symptoms of low testosterone are multiple, both for men and for women, by the way, because one of the things that we're doing trials now is supplementing testosterone in females, particularly patients who've had breast cancer, radiation and stuff, because testosterone doesn't increase their chances of relapse of their breast cancers, and as a general rule. But that's all off-label. That's at the moment. It's not mainstream yet. But the point is that once you get a low testosterone, I think the best way to contextualize it is to say that it's sort of like a menopause in women. You're going to get hot flashes. You're going to get decreased feelings of having sex. You're going to, for a guy, decrease erections, fewer morning erections, irritability and anger and depression are also big things as well. increase in body mass, particularly fat. Even if you're, because low testosterone pushes stem cells towards fat cells rather than muscle cells, which can then cause you to get obese, even if you are exercising and dieting nicely. And there's so many other things. And I want to just come back to irritability. A lot of people think that we are overdosing on testosterone, which does suppress your natural sperm count, by the way, and you also can make your testicles and decrease your sexual function. So don't be supplementing unless you need to. But the point is that the irritability is actually more from patients who have got low testosterone than from high testosterone. And to naturally improve it, the big one's the big five again. If you exercise, we know that increases your testosterone. The specific types of food can mess up your testosterone levels as well. Smoking damages again, and then stress itself can decrease your feelings for having sex. And of course, excessive alcohol. A lot of people think that alcohol improves their sexual function.
Yeah.
The data's off, really. The only thing that consistently happens to 80% of people who drink alcohol when they try and have sex is that they fall asleep. So that's the only one we've got scientific evidence for. But the thing is that it's a big issue to make sure that you do get if you get checked, because we need to do a morning specimen of your blood to actually tell if your testosterone is low, and then do the big five. If it's still low and you've gone into the menopause, there are things that we can use, and for our purposes, there's really testosterone supplementations, which are usually not those ones you might buy in the chemist over the counter, because it actually would cause damage to your liver if you know what's happening. But it's usually either intramuscular injections or creams. And there are some tablets which are not directly testosterone, but they stimulate your natural testosterone production, and these are things which are used off-label. That can be things like clomiphene, which is used for females to actually stimulate the eggs for a similar reason. And they are those options. But the thing is that, again, you need to have the low testosterone. You must be symptomatic from it as well. And symptoms doesn't mean just not having sex. It's also even just like this central obesity, because that's going to make the call on what you need to do. But you need to get yourself checked by someone who's got an interest in this condition.
All right. So before we took the musical break, you were walking us through the big five, and you're really breaking it down for us as to what we need to know regarding men's health, and also what the individuals can do themselves. Yeah. So you can pick it up.
Yeah. I think one of the aspects that we haven't touched on yet, but I think it's so important, besides is that, again, everything's interrelated. And general health, be it making sure that you've got a good diet's good, you're actually doing physical activity. It also then impacts even on your fertility as well. We know that males' fertility has dropped about 50% in the last 30 years.
Hey, that's a huge,
and it's huge numbers. And again, guys will often blame the female as the problem for this, but with reality, it's for our purposes, 50% of the time when a couple isn't able to have a child. And by the way, you must be having regular sex for about a year before you can make a call that you need to go for an assessment. But 50% of the time it'll be the guy, 50% of the time it'll be the woman. And of course, there's overlap with it. Sometimes both of them have it as well. So I think it's not just about the protecting yourself from cancers. It's also about procreation and the future for your own lineage, if that's what you're after. Because there's so many different aspects which are all boiling down to relatively simple things. The most common, the baseline is really just about inflammation in the body, which can cause damage to everything, including the causing diabetes, cancers, and things like that. But I think, again, if you just make sure that you take some critical steps to do the big five, plus making sure you do get checked out once in a while by a treating physician, and it doesn't have to even be a GP. You can even nurse. Our nurse practitioners are excellent people to do this as well, and of course their health days and that sort of thing. If you do attend them, make sure that you do get checked out, because if you just get this done once a year, or once every 2 years, you're in a much better position to prevent yourself dying from the main causes of death in men and women: cardiovascular disease and cancer.
Hello, Professor Shingai Mutambiro. I wanted to find out, is there a remedy for erectile dysfunction when it happens? I've reached 60 years now. Please kindly assist.
Oh, yeah. Again, take a step back. Behavioral changes, big five. Please make sure you do it, and make sure that if you're on treatment for blood pressure or sugar or any or cholesterol, do take your treatments. Having said that, a lot of guys don't want to take it because it can cause erectile dysfunction, and that's a big issue as well. But
also, the treatment itself can cause
The condition can cause it, and the treatment can cause it.
Oh.
But remember, the blood pressure is going to kill you.
Yeah.
The sugar is going to kill you, so you have to get it checked out. And I think the simplest way to look at it is that the penis is mainly made up of two sponge-like tissues, one on each side, called the corpora. And when a guy gets an erection, what's happening is there's a blood vessel, an artery, which pushes blood into these sponges and doesn't let the blood come out. So in other words, an erection is not a bone or a muscle, it's just a lot of blood in your penis. And remember, that blood vessel is also being put under pressure by things like high blood pressure, sugar, and that sort of thing, obesity, because it's blocking the blood, and then your blood can't go into the area, and that's what causes the vast majority of patients to get erectile dysfunction. Having said that, the biggest sex organ in the body is the brain. So even stress and depression and an uncomfortable relationship with your partner is a problem, can be a problem. The nerve supply is also important as well, and the man chemical testosterone. So it's a mixture of different things, but the vast majority it's going to be because of the blood is not flowing enough. And when that has a problem, then the first line of treatments is what we call PDE5s, or phosphodiesterase 5 inhibitors, which are these Viagras, these Cialis, the Vitras of the world. Very, very safe medications. All they're doing is increasing blood flow to the penis when the guy is sexually stimulated, and actually, they're super safe. We've actually published on this as well, that they actually can protect you from heart attacks, and so it's actually good. In fact,
so they don't cause heart attacks.
No, they can. Let me put it. They take steps. They don't directly cause heart attacks. In fact, when you look at the history, 1996, what happened? We were also involved in some of these trials afterwards. But what happened is the company Pfizer actually was using Viagra was trying to test it as a blood pressure lowering medication, and it didn't perform up to scratch. So when the recall for the drugs came back, all the women brought it back, but none of the guys. That's how it was discovered that it
oh no way!
Yes, that's it.
Are you for real?
That's exactly what happened. Having said that, females also, because the clitoris is exactly the same organ as the penis, and in fact it's the same length as the penis. It's just that it's hopefully it's thinner, but it's running in a loop around the vagina. So again, guys, you're not that much better. Your penis is not that much better than anything in a female. But the point is that we know that it actually can also improve some sexual function for females as well. But they're essentially super safe. There's a couple of things you shouldn't be taking them with. One is called a nitrate. That's what, if you've watched movies, when people have heart attacks, they put something under their tongue, which is supposed to open your blood vessels. And the PD5s are sort of like nitrates. So if you take them together, you can have a precipitous drop in blood pressure and die. And that's obviously apparently what happened to that Nigerian president. But there was something else that was going on. He was on a nitrate. That was the biggest issue. Second is if you are going to take them, you shouldn't have had a recent heart attack that's in the last 6 months, or be in what we call congestive cardiac failure, which is when you can't walk up 2 or 3 types of stairs because your heart's not pumping properly. And it's not because the PD5s are dangerous. It's just that sex is a form of exercise. And so if you have a congestive cardiac failure, or if you had a recent MI, you shouldn't be exercising. And but once you're out of that area, then good stuff, nothing too much dangerous. You'll see lots of other labels on it, but the reality is they're super safe. And then there are other options like injectables into the penis, which used by some companies to promote these men's health things and things. And then there's pumps, and there are various other things that are going on in the pipeline. For example, we're looking at stem cells to rejuvenate the penis. There's things like where we use shock waves to reopen blood vessels. There's lots of stuff down the pipeline, but the vast majority of people should respond to these PDE5s, and they're super safe for the vast majority of people.
There you have it. On that note, we take a musical break. We will be right back. You can also hit us up on our WhatsApp platform. Before we continue, Doc, Professor, there is a question here saying, can I get a yeast infection when my wife has one? And if so, is it curable fast?
Yeah, another myth. Okay, another myth. Essentially, this fungal infection or thrush, which is relatively common more in females than in males, is caused by a specific fungus called Candida. And if I was to take my skin and scrape it and look under a microscope, I'm telling you today, I would find that Candida on my skin. It's all over the place. And so it's not an STI per se. And I mean, there are some guys particularly who are predisposed to developing thrush, but that's usually if they've got diabetes, and because the sugar is a nice little area for the fungus to grow. So having sex with a woman who has thrush, and the only reason why women have more thrush is because the vagina is a nice moist little area, and they can get it there. But even then, it's almost, unless there's again diabetes or some other issue and it's particularly troublesome, the thrush is usually easily treatable with topical antifungals. You don't even have to take anything orally as a general rule. And as I said, the short answer, it's not an STI. You can't really pick it up from them. If you are getting so-called thrush, first of all, make sure it is thrush, because there are lots of other things that can look like it. And those things like herpes, which is a viral infection, which can come and go in the same spot. But the point is that it's the thrush itself is nothing particularly to be worried about. Just the one thing to look out for is diabetes, because it does predispose. Yeah.
Hi, V Candy. Hi, Professor. My urethra gets really itchy that I have to scratch it from outside the shaft. I even visited a doctor and had an STI screening. Nothing was found. Is there any chance a cancer that I'm yet to have, or they're really worried?
Yeah, I think first of all, the chance of cancer, it's possible, but it's very unlikely. And I think let me just take this opportunity, because I am one of the founding members of the Prostate Cancer Foundation, which has now got chapters even in Zimbabwe. We started in South Africa, so internationally from the world. But the point is that the prostate, short answer here, well, hopefully short. Testicle produces sperm. Sperm travel through a long tube that goes to the area of the prostate, which is sitting just below the bladder, all the way around the pipe for passing urine, which is also the pipe for ejaculation, which is the urethra, like you're talking about. Because we know that the only less than 1% of what a guy ejaculates is actually sperm. Most of it is stuff made by this prostate and another gland called the seminal vesicle. These are things like sugars, proteins, and such that support the sperm outside the body. And again, just to take a step back, that's why even if your ejaculate looks normal, there might be no sperm there might be a few sperm, we don't know, and that's why you need to be investigated. Now, the thing is, the prostate there are lots of different things that can cause this itchiness in the pipe for passing urine, in the urethra. But one of the more common is inflammation of the prostate, and that can be investigated and find out what's going on. Cancer itself usually does not cause itchiness. In fact, unfortunately, most prostate cancers develop on the outside part of the prostate. So by the time they're advanced, you don't even have any symptoms in the pipe. So again, you need to get it checked, get the blood test. You don't have to have the finger, I repeat. But the point is that I think if there's itchiness, he needs to be seen by his GP initially, but then I think you're now reaching the stage where you should be seeing your urologist, because there are other things like scars in the pipe called strictures can cause this. The inflammation of the prostate can be quite a problem. There are other things that can happen in the bladder. But the fact that you've had an STI screen and you probably had a urine test to find that's nothing exciting, then I suspect it's most likely going to be that there might be inflammation of the prostate, and there are some medications which can be put on, but you'd need to talk to your GP with an interest or go to your urologist.
Got a message here saying, how safe is it to use sildenafil citrate for men over 50?
Sildenafil citrate is essentially Viagra. It's one of the PDE5s.
He wanted to trick us. Okay, thank you, Professor.
No problem. Well, it is my job, so I'm impressed he's using because that's the molecule itself. So he's actually doing the correct thing. Like I tell my residents, don't use trade names as a general rule. Just use the things. But I guess for the lay public, it's our purposes, it's Viagra. The whole point is that we know that when we reach around the age of 40 as guys, 50% of guys are going to have problems with their erections. And as we get older,
really?
50%. And it's...
why is that so?
A lot to do with lifestyle changes and that thing, but it's also just aging. It's just wear and tear. And so it's extremely common. And again, to prevent it, you're getting erection problems, do the big five and take yourself checked out. You can delay it, but unfortunately, as the march of time continues, you almost certainly are going to get to the point where you might have a bit of a problem with the erections. And again, erectile dysfunction is really, it specifies that you're getting an erection which is not sufficient for intercourse or without satisfaction from the intercourse. And there are other things like libido and things which can also be related. But the short answer here again is that if you've been screened, you haven't not on a nitrate, you're not having congestive cardiac failure and that sort of thing, super safe. Super safe. And in fact, there's some data which we were involved with as well, where use of these drug medications, because you're getting more sex, and sex is a form of exercise, then you actually recoat the inside of your blood vessels, which then can improve your natural erections as well. So super safe, if they are helpful, and as I said, they published also that they actually prevent heart attacks in some people as well, and so there's very, very safe. Any age. In fact, I've even got young men who've had type 1 diabetes, which is one that's inherited, who have had damage to their blood vessels because of the diabetes. And from even the age of 17, 18, I've been putting them on Sildenafil and various other PD5s to check what's going on. But the short answer is that they're super safe. Just make sure you have been checked by your doctor that you haven't got those three big things that I was talking about.
Okay, thank you for explaining that. Two questions. Hi, Professor, I don't ejaculate easily. Is that a problem? And another question is, hi, Professor, what is the cause of premature ejaculation and how can it be solved? Yeah. So, yeah.
Okay, I'll start with the infrequent ejaculation. Remember, we have to specify whether you had orgasm and no ejaculation, or you're not having orgasm and that's why you're not ejaculating, because they're slightly different things. Now, this thing of not seeing of not having orgasm is almost regularly related to something in the psyche. It's a sexual, it's a psychological thing that's the vast majority of people. But if you're having orgasm but you don't see the ejaculate, that can often be related to the prostate, because if the prostate gets bigger or it's inflamed, sometimes what happens is the semen doesn't come out or it gets stuck in the prostate, and it can even go back into your bladder. You pass it out in the urine. Usually not dangerous, but the point is that you still have to rule out cancers. You still have to rule out the normal enlargement that happens after the age of 40. And so you have to make sure that you do get yourself checked out. But in general, both of them are relatively easy to treat, because even with if it's because of and if you're not seeing the ejaculate but you're having orgasm, often we can try some of the medications we use for the normal enlargement for the prostate, and it can come out and to do that. And of course, there are some operations that might have caused that as well. Now, premature ejaculation is by far the commonest sexual dysfunction that guys get. About 80% of us get it, and we used to classify it as if you ejaculate before penetration or within 30 seconds of penetration. We no longer do that. It's about your satisfaction. Some people, let me put it this way: the average a white American will ejaculate within 3.5 to 5 minutes of penetration. Of course, we blacks are we're much better. We last much longer. But the point is, if you even going over 5, 10, 15 minutes, which is relatively unusual for most guys, you're still not satisfied, then we still will classify it as premature ejaculation. And again, there are lots of treatments. There are behavioral modifications, pinching the tip of the penis, withdrawal, various other things, often don't work too well. And so often, because we now know that the vast majority of guys who have premature ejaculation, it's because of a chemical in the brain called serotonin, which is too low. And we have some drugs that raise it for premature ejaculation, but the vast majority of countries do not. And what we do then is off-label. We often use off-label, meaning that we're using a medication which we know can work, but it wasn't designed, it's not registered for that cause. But we often use forms of antidepressants, which are called SSRIs or SNRIs, which raise the serotonin in the brain, and because they have a side effect to delay ejaculation. And by the way, that can also be if you are on an antidepressant, that can be one of the reasons why you might not have orgasm as well. So it's one of those things that you have to balance. But it's super easy to treat for the vast majority. Usually people on the SSRIs or SSRIs on a daily basis, but it can also be used on demand, just like with the PD5s, and that usually clears it up. There are other drugs that are in the market that are coming out soon that were on trial for the same situation, because some of these antidepressants can make people a little bit drowsy or anything, that sort of thing. But it's actually relatively easy to treat, so you must get yourself just seen by your GP or your urologist.
So someone asking, what's the average time to get satisfaction? What's too long and what's too short?
I think, first of all, remember that there's we think communication is the biggest issue, because when you look at, for example, the average, only 20% of females get orgasm from penetration alone. Only 20%. And even if they do, it takes them between 21 and 25 minutes to do that. Meanwhile, we're ejaculating maybe 5-10 minutes. I think the important thing is to remember foreplay. Sex is not just about penetration. It's about touching. It's about talking. It's about making sure that buying a flower for your wife or something 24 hours before is part of the sex. That's what's going to make her feel like having sex
Hello.
in the future. So, and we guys are not good with communication. We just think wham bam, watching porn movies. And by the way, guys, your penis is fine. The size is normal. Okay, don't worry. You're watching porn and you see the things. Of course, they wouldn't Photoshop. Of course, they're photoshopping them. And the average porn movie takes between 2 and 3 days to make.
Oh,
And so
average.
And so that 10-15 minutes was taking 3 or 4 days, and you're saying, oh no, this guy is big, long dong silver, rubbish. All nonsense. Your penis is fine, but communicate. Don't just base it on that, no, it was wham bam, that's exactly what's going to happen.
I wish we had more time, eh? Professor, but tell us what's happening tonight, and also if you have any handle, social media, where to find you.
Yeah, no, I'm not really on social media much, but there are some, you can find me on my university websites and stuff like that. But yeah, tonight, please, just to join us, it's we're going to be having a meeting at Rohari Golf Club at 6 o'clock. For guys and for women, by the way, because as I said, women, the partners are very important as well. And you can come through. It's $15. It's not coming into my pocket. It's going to be siphoned to make sure that we get more urologists for Zimbabwe. It's for their training, and that we'll have a bit of discussion. There might be some few tests here and there, but I think the main thing is just to make sure that we enjoy ourselves and we make sure that we actually start communicating not only with our partners but also with friends and partners on the golf course as well. Thanks.
Well, thank you so much, Professor Shingai
Thank
Mutambiro. I appreciate you so much for making time. See you later.
See you later. Thanks very much for the opportunity, everyone.
Wonderful. Star FM back with you tomorrow. I am V Candy. Remember, tomorrow belongs to God. Take your time with mine.